We all know lung cancer is a very deadly disease, but today we'll talk about one lung malignancy which is a story of hope. It's about a gentleman who has recovered and is doing quite well right now. Mr. Ranjan Mitro is a defense engineer and led a very active life. He needed to be in battlefronts, which meant his physical fitness was of paramount importance for his job. However, about 2 years ago, he suddenly coughed up a lot of blood, and that meant he went to multiple centers to get a diagnosis with bronchoscopies and multiple biopsies. He was always told that he had a very small rare tumor in his lung. However, he got no answers as to how to cure. Earlier this year, he suddenly had a very bad episode of bleeding where he almost coughed up one cup full of blood. And he also developed a very severe form of breathlessness, which meant he could not do his daily activity and he could not sleep comfortably at night. He visited the Peerless Hospitals and got in touch with our medical oncologist, Dr. Bhattacharya. After the preliminary investigations in form of chest X-rays and a Dotanog scan, it was found that his entire left lung had collapsed because of a tumor which was sitting right on his left bronchus. So a multidisciplinary team meeting was organized to discuss this case at length. This meeting included surgical oncology team along with medical oncology, radiation oncology and other allied branches like radiology and pulmonology. We realized that removing the entire left lung was not an option for this gentleman because he would not ever be able to breathe normally again, and he will not be able to go back to the active work that he did. So we decided a staged procedure would be a better option for him that would give us the best outcome. So initially a debulking was planned, which was done bronchoscopically, where the tumor was sitting in the left main bronchus. We cut it back so that the left lung would completely open up, and that would let his breathing become more easy and he will be able to tolerate the bigger procedure, which would mean removing only half of his left lung, where the tumor was growing from. So after his debulking procedure, he had undergone a series of chest physiotherapy and a lot of rehabilitation to prepare him for the bigger surgery that required about 2 weeks' time. And once he was fit enough and his breathing became better, he underwent a pre-anesthetic checkup under the supervision of Dr. Bhattacharya, who assessed him for this major procedure. On the day of the surgery, he was planned for a video-assisted thoracoscopic surgery, also known as VATS, which is a minimally accessible procedure. However, due to intraoperative bleeding, we had to convert it into an open surgery. The entire left lower lobe of the lung was removed along with the tumor and adequate margin and sent for histopathology examination. His post-op recovery was surprisingly quite fast and we were able to send him home in a very stable condition within 4 days. So the take-home message is, in spite of the fact that carcinoid tumor is very rare, and we see it in less than 1 per lakh population, curing such a rare disease means that multiple specialties has to come together and work in sync to give the best outcome to the patient. Today he'll be able to go back to his normal life and go back to his job, which is a very high demanding job, as an absolute fit person. This gives us immense satisfaction that we have been able to handle something as difficult and as rare as this case, and the patient is doing.
Hello, I'm Anjan Mitra. I'm a petroleum engineer working with the US Armed Forces in different war zones in Middle East, Russia, West Africa, Angola, Zaire, and of course in US and England. And after many years of working there, I decided to stay for a while in India. Since my profession requires me to be highly physically active, I work out and exercise regularly. And I used to go for long walks, exercising. in a park right in front of my residence. And somehow, due to sweat and rain, uh, after workout, when I came back to my home, the air conditioning was such that I got cold and ran very high fever and I passed on. And I was twice this happened, and I was taken to local places for diagnosis, and that did not happen locally. The diagnosis couldn't be done. So I have a family friend who knew Peerless Hospital for many, many years, brought me here to meet Dr. Rajiv Bhattacharya, but very well coordinated by Dr. Pallabika Mandal and Rajiv Bhattacharya. And after that, when I came to senses, I, I was informed that the surgery was successful, and I am in the ICU. And within a couple of days from ICU, I was removed to the ward, and after that, again within a couple of days, I was made to walk, and uh, they said I could go home. And, I'm grateful to Dr. Pallabika Mandal, Rajiv Bhattacharya, and the entire tumor board. They had coordinated a board meeting to analyze my case, which was very caring. And even after the surgery, I got calls from Dr. Pallabika Mandal, Mr. Sudeep Das, who is a coordinator. That shows the amount of caring Peerless Hospital has for patients. So, thanks to all the doctors and staff who saved my life. This was a major surgery, but with the ease and the professionalism and calmness the doctors finished the surgery is amazing. Thank you, Peerless.